Dr. Shumona Haq, Consultant Fetal Medicine at Bhagirathi Neutia, Newtown. And today we are here to discuss about the important topic, that is the benefits of early pregnancy scan. Now, when a lady misses her periods, she expects a pregnancy and undertakes a urine pregnancy test. This urine pregnancy test does not confirm whether the pregnancy is healthy or not. To know whether the pregnancy is healthy, she must undergo the early pregnancy ultrasound. This is the first of the 4 most important ultrasound that the lady must undergo in order to know that she is having a healthy pregnancy in an uncomplicated pregnancy. It is typically done between 6 to 8 weeks of gestation, that is, as soon as the lady misses her periods. It is done by the transvaginal approach because the fetus and the gestational sac at this time is very tiny, and to get a more precise view, this is the best approach we can adopt. The lady voids just before she undergoes the scan. So firstly, we rule out ectopic pregnancy. So what is ectopic pregnancy? Ectopic pregnancy is the condition in which the embryo is implanted anywhere outside the uterus. It can be the fallopian tube, or it can be the ovaries or any other intra-abdominal organs. It is extremely life-threatening for the lady, and the sooner it is diagnosed, the better it is for everyone, so that management is planned. It can be treated both medically and surgically, and we can prevent the dreaded complications such as rupture and hemorrhage. Next, this also helps us to detect whether this pregnancy is viable or not. A viable fetus is the fetus which has a regular heartbeat and has appropriately grown as corresponding to the last menstrual period or the date on which the embryo is transferred in case of an IVF pregnancy. These 2 points confirm whether the pregnancy is viable. This scan also helps us to know the gestational age of the fetus. So it is very important that we know the gestational age of the fetus, and it is done by measuring the length of the fetus, that is the crown rump length or the CRL of the fetus. It is helpful for women who have irregular periods such as PCOD or lactational amenorrhea. It is also very useful for women who do not remember the last date of their menstrual cycle. This scan also helps us to know if there are multiple fetuses and if the fetuses share the same placenta or they have their own separate placentas. So this is known as chorionicity. Chorionicity helps us for the future management. So if 2 fetuses share the same placenta, that is in case of monochorionic twin, we know the number of complications are more in these type of pregnancies, and these women need more frequent follow-up. Next, when a woman reports to us with bleeding or spotting per vagina, this scan helps us to know if there are any perisac or subchorionic hemorrhages, and if at all, if it is there, what is the size, that is if it is mild, moderate or severe. Accordingly, the consultant obstetrician treats the woman with injections and medicines, and at the time she is asked to take certain precautions and lifestyles or modification, so that in the future, dreaded complications like miscarriage can be prevented. This scan also helps us to see the areas surrounding the fetus and the gestational sac, whether there are any tumors or cysts, such as in case of fibroid uterus or in case of ovarian cyst or fallopian tube cyst. It also explains that why some women complains of excessive pain during the pregnancy. As the pregnancy progresses, these cysts and fibroids can be monitored and managed accordingly. So the benefits of early pregnancy scans are many, and hope this video provided the insight as to why it is important and it should not be missed. Best wishes from us. Thank you very much.